Every day in the US, thousands of patients go into surgery. They're prepped with standard bed sheets and gel pads. An insecure, time-consuming method that leaves patients open to nerve injury, pressure ulcers, and eye injuries when they wake. It also puts nursing staff at risk of back injuries while moving patients. It doesn't have to be this way. Opt-Shield is an advanced, safe patient handling system, a leap forward for patient safety, patient comfort, staff safety, and surgical efficiency. Opt-Shield fits most gurneys, OR tables, and tables in catheterization labs and radiology. It buckles to the OR table to reduce the risk of sliding in extreme surgical positions and saves precious and costly minutes in the OR.
The Velcro fasteners, I think, are particularly helpful, particularly after a long case where you're a little bit tired and you have a lot of things you need to take with the patient, perhaps to the intensive care unit.
Velcro straps and pockets secure suction tips, IV lines, and other medical equipment.
In addition, it's very useful to have the multiple handles as well as the low friction surface, which allows us to, in a controlled fashion, move the patient from the operating room table onto the recovery room bed.
Opt-Shield's built-in handles and low-friction fabric ease the burden of lateral transfers and reduce injuries to hospital staff.
For the built-in arm padding system, it's easier to tuck arms by myself, even on obese patients, and I do not have to look for gel pads.
A patent-pending fastening system comfortably cradles and slightly raises the arms, putting far less pressure on vulnerable nerves. The patient's arms and legs stay secure before, during, and after surgery. Internal padding in critical areas reduces the risk of skin breakdown without cumbersome gel pads.
I've also found the arm padding system to be very useful in protecting the patient from self-injury during emergence of anesthesia. This helps protect from injuries such as corneal abrasion.
Waterproof and single patient use, Opt-Shield lowers the chances of infection and cross-contamination. BCG Medical recently completed a successful pilot deployment of the Opt-Shield Safe Patient Handling System at a major tertiary care hospital in San Diego. Feedback was overwhelmingly positive. Every user in the pilot deployment wanted to use Opt-Shield going forward.
It's a safety issue, and it will prevent them from dislodging any of our critical lines that we have placed in the patient.
The sliding system makes it very easy to move the patient from bed to bed. The slippery surface underneath and the handle system and also a slight tilt in the bed makes it very simple.
For the safety of patients and staff, for efficiency in the operating room, it's time to move to a safer patient handling system. The BCG Medical Opt-Shield.